Welcome to Biochem Weekly, Week 3. Amino acids continued. This week we're going to be talking about metabolic disorders, one in particular, homocystinuria.
So what is homocystinuria? It is a disorder of methionine metabolism, leading to an abnormal accumulation of homocysteine and its metabolites in blood and urine. So again, the amino acid involved is methionine, and the deficient enzyme is cystathionine beta synthase, or CBS. Why is that? It's a genetical disorder. That means it's, for this particular condition, on the chromosome number 21. There will be an increase in homocysteine and therefore an increase in the excretion of it. Let's look at the chemical reaction, which was here, sorry. Basically, when we see CBS, it's supposed to transform homocysteine into cystathionine. Because this is deficient, the reaction will go into the other direction, meaning homocysteine will be transformed into methionine and accumulate.
Okay, so what are the signs and symptoms? The signs and symptoms can be highly variable. Some of them include severe near-sightedness, glaucoma, retinal detachment, cataracts, intravascular thrombosis, long limbs, seizures, a tall, thin build, flushing across the cheeks, and even degeneration of the optic nerve. This is an example of long fingers and long toes. There's no correlation between age or gender with this disease. The signs and symptoms should be prevalent in the patient's first year. It may be diagnosed through newborn screen programs. A urine test or plasma test may be used to measure the levels of methionine, homocysteine, and homocysteine. So how do we prevent this? Unfortunately, this disease is genetic, so you can't really do anything to prevent it, but your risk of obtaining this disease may increase with inbreeding, so try to avoid that. What's the treatment? Doctors first recommend patients to take high doses of vitamin B6 supplements. If the patient has a positive response to this treatment, they may have to take vitamin B6 for the rest of their lives. If the patient doesn't respond well to the vitamin B6 supplements, then they should try a diet with low foods containing amino acid methionine. A diet in low protein is best in general. People who are diagnosed with homocystinuria at an early stage have had positive responses after switching their diet to this. Other supplements may benefit them. Thanks for watching, guys. See you next week.
See ya!